Good afternoon, everybody. My name is Thomas Davidson, and I'm pleased to be able to share with you my experience supporting the creation of Island Health's new climate change collaborative. Before I begin, I'd like to acknowledge that I'm a grateful, uninvited visitor on the lands of the Songhees, Esquimalt, and Musqueam people, who have been incredible stewards for this land for time immemorial. I'll begin with this image of the Royal Jubilee Hospital last September. Those of you who were in Victoria will remember the wildfire smoke. This is just such an obvious example of the intersections between, or the interconnection between climate change and health. As the climate changes, we'll see more wildfires. More wildfires means more smoke. More smoke gets in more people's lungs, which is bad for people's health. Of course, there are also less obvious, less visible impacts on health, including impacts on food security and water security. And these sorts of impacts are always felt the most by most vulnerable people. These less visible impacts can also include things like changing disease patterns. So the classical example during my undergraduate degree back in Ontario was Lyme disease, with the tick vector expanding northward as the climate warms. And so Ontario is seeing more and more cases of Lyme disease. Since I moved out to the West Coast, I learned about Vibrio infections. So in fresh seafood, that increased ocean temperatures mean increased risk of these Vibrio infections. Just recently, I learned something which I hadn't thought at all about before, which is that there's increased foodborne illness during hot temperatures. So in the summer months, we see more foodborne illness because of changes in food handling practices. So when people have barbecues or picnics, they don't handle the food as safely, and we see more cases of things like salmonella poisoning. So climate change is affecting people in very obvious, straightforward ways, but also affecting patterns that are a little bit more complex and maybe not as obvious on the surface. And climate change is evidently already affecting people, the way people live, work, and play in all island health regions. And in the face of that, I see island health having two main responsibilities. The first is to continue the healthcare services uninterrupted in the face of these changes, but also to support climate resilience in the wider communities served by island health. And both of these responsibilities will be best served when island health is collaborating effectively. When I think of collaboration for climate action, my first thought is things like the Paris Agreement, big international accords coordinating international response to climate change. And there are similar types of coordination at different jurisdictional levels, from the international with the Intergovernmental Panel on Climate Change down to the local City of Victoria Climate Leadership Plan. What I hadn't thought about before this practicum experience with island health was the importance of collaboration within organizations. But it became very obvious to me just how important that is when you have an organization as large as Island Health, not just with such a large geographic area with diverse types of populations, but also a range of services provided and a range of different expertise. So the purpose of this collaborative within Island Health is to bring these experts together. I know it's a little bit of a cliche to throw up a definition, but I do think this one's actually very useful. According to Gray, collaboration is a process through which parties who see different aspects of a problem can constructively explore their differences and search for solutions that go beyond their own limited vision of what is possible. I think the key message from this definition of collaboration is that collaboration really takes differences, different opinions, different perspectives to move beyond individuals or groups' ideas of what the right way is to move forward. And so in the context of climate change, one of those sort of ways of not necessarily disagreeing, but having different perspectives or different priorities is contrasting between mitigation and adaptation, both of which are essential for climate resilience. Mitigation is about slowing down the rate of climate change so that we have time to adapt, whereas adaptation refers to making changes that reduce the risks associated with climate change. So mitigation can include things like increasing energy efficiency, using renewable energy sources, as well as capturing carbon that's already been emitted. Whereas adaptation refers to things like building resilient infrastructure or planning for changes like the changes in disease patterns that I just talked about. Mitigation and adaptation, however, don't have to be separate, and they often actually run in parallel. So Island Health Facilities Department focuses mostly on climate change mitigation by reducing emissions. But in their projects to implement heat recovery systems and their ventilation systems, that not only reduces energy use and therefore emissions, but it also, those systems can be used for mechanical cooling, for air conditioning, making those buildings more prepared for future climate, where we will have more and more hot days. On the other hand, community planning, which is supported by Island Health's Healthy Built Environment team, generally focuses on adaptation. But some of the initiatives that are key parts of creating a healthy built environment and a healthy community include things like active transportation, which not only reduces health risks, but also reduces emissions. So it's contributing not only to adaptation, but also mitigation. So in order to make these connections and break down the silos between departments, this collaborative has had two big meetings, one in October of last year and then one just in March. It had about 30 people at each meeting, where we had presentations from experts talking about these links between climate change and health, but also lots of time for breakout rooms for people attending the meetings to actually make those personal connections and identify people who they can collaborate with in the future, as well as doing interactive activities like the one on the bottom of the screen here, which is based on the BRACE framework for creating environmental health risk assessments. So not only an educational component, but also really coming together to identify risks and opportunities to make change within Island Health by breaking down these silos. My culminated project was a process documentation of the formation of this collaborative. And this flowchart shows the process that I saw. So I witnessed it begin within the sphere of control of some key members of the Island Health Facilities team, who then used their what are called the collaboration literature heritage relationships. So these are strong relationships that exist prior to the formation of a team, or in this case, the collaborative. And those relationships were with members of the Healthy Built Environment team. So expanding the reach and reaching out to more different experts across Island Health. Then these two meetings in October and March really demonstrated the value of this collaborative of the teams. And now I see the collaborative needing to determine goals and structure more specifically before inviting wider participation and reaching even more experts across Island Health. These are two possible structures that the collaborative could take moving forward. There are many other possibilities and could contribute to both sort of parts of each of these structures. So the education liaison model is similar to what's already been happening, where members get together and learn and share with their teams, which has less additional input in terms of time and energy, but also is less impactful. Whereas a steering committee with working groups could allow members to work on shared identified projects, which is action oriented, which the members have indicated they want, but it's also time and effort intensive. So finding the right balance there between what people want to do and what people actually have the capacity for will be important. And then another really important question is whether to formalize the collaborative, which could allow for more resources and credibility and accountability for the group. However, at the same time, it might increase the time and effort devoted to protocol rather than to action. I put in this work off the side of my desk because that's something I hadn't heard at all before working with Island Health. And it actually shows the benefits and drawbacks of formalization, where people might have devoted time to actually work on these projects, but at the same time would need permission from leadership to be able to devote that time. So ironically, for a group focused on environmental sustainability, the Climate Change Collaborative really needs to focus now on creating a sustainable structure moving forward in order to fulfill their vision of supporting each other to take action on climate change. I'd really like to thank not only my supervisors at Island Health, Miroisha Gully and Jade Yehia, who were absolutely fabulous while being so busy with COVID response, but also, of course, Dr. Nigel Livingston for guiding me through this process.